We will now hear from our final panelist of the day, who will talk to us about the amazing work being done in federally qualified health centers. These centers across the state act as a bridge to care for Arizonans who may have no other way of receiving dental care. This panel will be moderated by Da-Nell Pedersen. Da-Nell is the Director of Training and Events at the Arizona Alliance for Community Health Centers and leads efforts around member engagement, training, facilitation, and event management across the organization. Da-Nell has worked with community health centers for over 12 years and is privileged to support Arizona's health centers through training and professional development, as they strive to meet the needs of the communities that they serve. Look out for our final poll, and then Da-Nell will take it away.
And our poll question is, have you ever received dental care at a federally qualified health center? I know that I have, and it's a great experience. It's like about 31% folks so far have, 9% have not. And hear about how these federally qualified health centers are such an untapped resource for dental care. So if these some folks can't remember, maybe it was so long ago.
Can you disable the camera for Shuntae, please? Sorry.
Yes, I will do that. And looks like Ruth might need to be disabled as well. Okay, everyone should be able to come on.
All right. Well, thank you for the opportunity to be part of this discussion. Again, I'm Da-Nell Pedersen. I work with the Arizona Alliance for Community Health Centers. Because we're going to be talking about federally qualified health centers, I thought it might be helpful to go over some terminology. FQHC is actually a term used by CMS, and it simply indicates that an organization is approved to be reimbursed in a specific way. But not all FQHCs are the same. There's actually different qualifications that you can meet to be considered an FQHC. In general, however, when we're talking about FQHCs, or when you hear people talk about FQHCs, and specific to this conversation today, we're really referring to HRSA Health Center program grantees and lookalikes. In Arizona, that group makes up the majority of FQHCs in the state. 23 are HRSA Health Center program grantees, 1 is a lookalike, and then the other is an urban Indian program. So we actually try not to use the term FQHC because it can be misleading, because all HRSA Health Center program grantees and lookalikes are FQHCs, but not all FQHCs are HRSA Health Center program grantees. So we like to use the term community health center, which I heard Barb use, and we sometimes use health center interchangeably. So community health centers in Arizona, you heard Jennifer Burns reference this. There are 23 health center program grantees. We make up the largest network of primary care providers, serving 1 in 9 Arizonans. The majority of patients that are seen at Arizona's community health centers are receiving primary medical services, but we do have 15% receiving dental services, and you will likely hear from our panelists today why more of our patients are not receiving oral health services. Arizona Health Centers employ over 7,800 FTE, and that includes over 100 dentists, 60 hygienists, and 300 other dental personnel like dental assistants. I love this scope of care chart on the right. This is created using UDS data, which health center program grantees and lookalikes are required to submit. I love it because you see a very large piece of the pie that is prevention. And prevention is such a key element to the community health center model of care. And you see that show up in dental services. However, our health center dental programs are also providing a full scope of dentistry. And you may hear from some of our panelists today about why maybe restorative isn't a little higher and why emergency is high. 10% is actually pretty high. You may hear some of those things today, but I just wanted to highlight that community health center, that model is really about prevention. And I am such a firm believer in the health center model of care. It is my passion, and I also believe that health center dental programs are one of the best kept secrets in healthcare. So I'm really excited for you to hear from some of our community health center representatives today. So I'm going to introduce our panelists. We have Dr. Christopher Brendemuhl, who is a general dentist with Valleywise Health, the safety net healthcare system for Maricopa County. He spent 11 years at the Valleywise Community Health Center McDowell, focused on treating patients living with HIV/AIDS. He has served as director of dentistry since January of 2021, overseeing the 5 FQHC dental clinics within the Valleywise system. He also provides care for the inpatient population at Valleywise Health Medical Center and chairs the Department of Dentistry within the hospital. He is a graduate of NOAA's National Oral Health Leadership Institute and is certified in dental infection prevention and control. We also have Shuntae Dinsmore Blackwell with us. She's the dental program manager at Neighborhood Outreach Access to Health, also known as NOAA, that has a passion for fair and equitable healthcare. With 25 years of experience and a background in dental clinic operations, Shuntae has worked in both the private and public health sector, developing operational best practices. Her experience has lent her the ability to effectively maintain dental healthcare standards and implement strategies that impact program objectives. In her spare time, she enjoys reading, traveling, and exploring new culinary experiences. Which I'm going to steal, by the way, Shuntae, because, you know, it's better, it sounds fancier than saying I just like food. I'm exploring new culinary experiences. I love that. Our third panelist is Ruth Trujillo, and she is the Embedded Dental Hygiene Director at El Rio Health, specializing in high-risk patient populations, including pediatrics, pregnant patients, and those living with HIV/AIDS. Ruth's expertise lies in developing and implementing comprehensive dental care programs that prioritize preventive measures and ensure access to quality dental care. Ruth has more than 15 years of dedicated service in public health, as well as the private sector, including 10 years at the Pasquayaki Tribal Dental Center, which is an IHS clinic, where she participated in the development of outreach programs, including the Head Start dental program. So welcome to all of our panelists. We are going to kick off with our first question, which is to start by briefly sharing a little about your health center and why you think FQHCs are so valuable. What makes them different from a standard dental practice? And I think we will start with Shuntae.
All right. Good afternoon, everyone. So I am the program general manager here at NOAA, and what makes us unique is that we take an approach to care focusing on the whole person. So not only do we look at the dental patient in the chair, we assess them and make sure that they have resources for mental health, for medical, for social determinants of health. So it's really important for us not to see that person in the chair just as a dental patient, but as a person who may need access to healthcare overall. We like to ease the access to healthcare for the underserved populations across the valley. I would think that FQHCs or health centers help improve oral care for vulnerable groups who face various access barriers, like a shortage in dental and medical health professionals, lack of providers who are just not willing to provide access to care for the Medicaid population or the uninsured or the underinsured. So it's really important for us to have a presence in those communities. One great thing that we do at NOAA is we really focus on an approach to care with our medical and dental integration. So we have dental hygienists embedded in our medical pods to provide that initial access to dental care, not only just for the kiddos, but even spreading that education onto the families.
Awesome. Thank you, Shuntae. I think because you mentioned your medical dental integration program, I'm going to go over to Ruth next. I know El Rio was probably one of the first to try that embedded program. So Ruth, will you share that with us?
Absolutely. Hi, thank you for having me. I'm super excited to be here with you, great panelist. So I like to pretty much what Shuntae has shared with us. El Rio, as you may know, is one of the largest FQHCs clinics in Southern Arizona. We have been in existence since 1970, over 50 years. And we started with a small dental clinic, medical clinic in center of Tucson. And we have now expanded to 13 medical clinics throughout the community, 7 dental clinics. And we serve, well, a lot of people out here. Our population, it's pretty diverse. We have 125,000 registered patients. Our services are very similar as what Shuntae had just mentioned, where we also have the embedded dental program in our medical facilities. And we started that right about 7 years ago at one of our large medical clinics for pediatrics. And now we have extended those services to 10 different clinics. And yeah, pretty amazing work that we do. We have 10 dental hygienists with a team that is 10 dental hygienists, each with a dental assistant. And we, like I said before, we are in 10 different locations. And we have even expanded our embedded dental program into pregnant women, as well as those living in, the homeless population at our Center for Opportunities. And we have continued to grow this program. Like I said, it was 7 years ago, and we have done a lot of great work here in the community in Tucson.
Thank you, Ruth. And we might come back to that hygienist assistant combo, because I know that's not super common for hygienists to have their own assistant. So we may come back to that when we talk about strategies and innovation. But Dr. Brendemuhl, if you'll share with us a little about Valleywise.
Yeah, thanks, Da-Nell. And it's a pleasure to be a part of this group, because it's always nice to be in a group where you're like, wow, El Rio, no, like those are good groups, and like hopefully Valleywise is contributing to the community the way that my colleagues are. For those who don't know Valleywise Health, we used to be known as Maricopa Integrated Health System. We are sort of the county level safety net healthcare system for Maricopa County, the greater Phoenix area. So we're publicly funded, but we are a federally qualified health center. We have, sort of our main medical center, and our new acute care tower is actually opening in about a month, June 13th, which has been super exciting, because that's been a long time coming. But we have, I think, 14 federally qualified health centers throughout Maricopa County at this point. 5 of which have dental clinics. And so our dental clinics are co-located and integrated into those medical clinics. We have a shared medical record that really helps our ability to communicate, as well as sort of share findings. I think the integrated model makes us better dentists. It makes us better care providers. And I think that the health center model is, in an ideal world, for me, it would be sort of the future of the way that we do healthcare in a lot of ways. Like having dentistry as part of the primary care team, putting the mouth back into the body, sort of, those types of cliches that everyone likes to spout off about. It's really great. And I think that we're trying to work, and I'm personally trying to work to advance the way that we do things in the integration spaces. I think that's been one of the most rewarding parts of my career, is to be a part of a team that was so hand in hand. I spent 11 years at a clinic solely focused on patients living with HIV or AIDS. And I will tell you right now that the fact that I started working there is the only reason I'm as far in my career as I am, because I got part of a healthcare team that was so incredible and did such amazing work. And I see that Tamara just kind of commented in the comments too about like having a dental hygienist in the ICU of a hospital, which is something we want to do, which is something I'm trying to get done because I've seen some of our other community partners do some incredible things. So yeah, I really appreciate the chance to be here to be a part of the panel today. So.
Thanks, Dr. Brendemuhl. And I can say with confidence that Valleywise is contributing just as much as all of the other health centers in the state. You all are all so unique and contribute a lot to our system. I'm going to piggyback off of, 14 health centers with Valleywise and only 5 with dental. So I'm going to use that as kind of an impetus to ask our next question, which is, what is the biggest challenge you face as a dental professional working at an FQHC, and what creative ways has your health center and FQHCs in general been addressing these challenges? And we'll go ahead and start with you, Dr. Brendemuhl.
Oh, capacity. They're, trying to keep up with the demand. Like there's so much need in our community. And the way that the population of Arizona is growing, Maricopa County is one of the fastest growing counties in the country, but the entire state is growing and the need is growing in each of our communities. And so when we take a healthcare system that is already kind of burdened, and I think there's a lot of things that we do really well that we try very hard to provide, excellent care to every patient. But when we're already booked out months at a time, and then you keep growing the population that we're trying to serve without adding additional services, space, providers, that is a challenge. And as a provider, it drives me up a wall when I can't get treatment plans completed in a reasonable or short amount of time. When I have patients with, urgent needs that I can't see as fast as I want to, it absolutely drives me batty. As a director, it's the thing that keeps me up at night saying, how are we going to be able to help all these people? How can we make meaningful change in the oral health of our communities if we can barely keep up with the patients that are here now? And so I am constantly advocating within our system for more opportunities. Our main clinic is in a 3-story building right next to our new hospital that's being built. And I'm like, just build a 4th floor. Just give me a 4th floor, make it an entire dental suite. I will double our staff and we'll do so much good. I think that is, but it's tough. It's, funding is scarce in some ways. There are a lot of great community funders. I know Barb with Da-Nell, Arizona, who spoke earlier, has been a great partner of ours, and they've done some incredible things in the community. But we have to find creative ways to keep up with the need. And I don't know that I have all the answers. And there's a lot of difficult, I have an idea, but maybe we can't get it done for one reason or another. So I love being a part of groups like this and like the Arizona Alliance and, National Network for Oral Health Access. I think the more we engage in these communities where we bring like-minded people together who are really trying to fight to get things better, I think that that's going to be a key to moving us forward. So.
Thank you. Yeah. And I had a dentist explain it to me this way once, just in terms of the difference between medical and dental. And it's really simple, but he was like, what do you call a room on the primary care side? You call it an exam room, right? Because you're doing exams all day. What do you call the place where you go and, in a dental clinic? You call it an operatory because you're doing procedures all day. And so naturally, the cost of that service is going to be much higher. And so that is why you often see, 88% of patients receiving medical and only 15 receiving dental. It's not because the need isn't there, as we've talked about, all afternoon. It's because the resources to address those needs aren't there. So we'll go to Ruth. I imagine you have similar challenges. If you have any additional, please share those, but also talk about maybe how El Rio has been innovative to address those challenges.
Absolutely. Same sentiment as Dr. Brendemuhl. I mean, how can you serve such large population? And as we know, Arizona, we have so many transplants. We have so many people moving into Arizona. And along with that, we also have people moving from other parts of the country that are already facing a lot of financial burden and recent homelessness and all of that. So there's no way we can serve everyone. We just want to focus in trying to do our best. And that is one of the main focuses at a Rio Community Health Center. We are really, really working with community partners to trying to alleviate that I mean, it is the problem. It's a community here in Tucson, Arizona. And one of the things we're doing, and we have been done in the past 5-7 years, we have grown. We've opened 3 additional clinics, medical and dental, and trying to do our best to just provide all of the services, and not just dental, but medical. We have an array of different services that we provide here in our clinics. But again, it goes back to the same question. We can continue to grow, but the need will always be there, where the need is larger than the services and even providers that we have and services to provide to the community.
Yeah, thank you, Ruth. Can you elaborate a little on how your embedded hygiene program works? And just kind of the in the weeds details of how you do that, and kind of what the impact is.
Absolutely. Well, it's been an amazing program, and the community has definitely benefited from this program and continues to. I mean, so much so that we now have, like I said, 10 teams all through Tucson. Some of the things that we are seeing is that a lot of our patients and parents were not educated on the importance of oral health. There has been, as we all know, the misconception that you go to the dentist at age whatever. I mean, we see people from all over the country with different ideas of when to take your child to the dentist. Some 5 years old, or whenever there is a problem, that's when you go to the dentist. And that we are educating our community about the importance of seeing the dentist as soon as you can. We say as soon as you have your first few primary teeth, 6 months after that, the latest. So what the team is doing is educating our communities, educating the families. If you can imagine coming into a medical visit, not only you're educating the parent and the child, you're educating the other people that are coming in at the time of the appointment. Some of the things that we're focusing on is scheduling real-time appointments, and that is a huge drive of our pediatric program here at Rio. So not only does the patient already lives at the end of their medical appointment with the information provided by their medical team, but also now they were screened, received a dental screening, provided information such as oral hygiene instructions. We spend time talking about the importance of nutrition, good nutrition, and things to avoid that can cause cavities and things like that, those kinds of highly sugared foods and things like that. They also, most of the time, they leave with already an appointment at hand. And even some of these patients and parents who already have a dental home, they are missing their appointments. They're not following up to their restorative care. A lot of our patients go into the other side of the border to receive dental care or even orthodontic care. And we're there to remind them, you don't just go every 3-4 months or whenever. You are supposed to go every month, right? And follow up with that. Just educating the public. That is the main focus. And we're just trying to do the best we can. There's a lot of need, more than what we can serve, but we're doing our best every day.
Yeah, I absolutely love that focus on education. I think that's so important, because I think we've all heard the statistic about, how much care happens in a doctor's office versus at home and just in your normal life. So I think that focus on education is huge. So thank you.
Absolutely.
Shuntae, what challenges do you face at NOAA? What have you seen, and how have you been innovative in addressing those challenges?
Definitely the same sentiment as both Ruth and Dr. Brendemuhl, with the lack of resources and the increased demand. We just in the short time that I've been with NOAA, we have expanded the size of 2 of our clinics, and we still do not have enough space to provide the access to care that we need to. One creative way that we wanted to hone in and focus on the targeted population, which is the kiddos, is to ensure that with every well child visit that is scheduled, we schedule a dental exam with the families who do not have a dentist or a dental home. So not only are they coming in for their well child visit, they're going to come in for their dental visit as well. Our hygienists that are embedded in our medical pods have increased our pediatric volume in our dental chair by 36% just since we've piloted the program. In addition to that, it has also allowed us to connect with the parents, the grandparents, the uncles, or whomever may be bringing that child, because they need dental care too. So we want to make sure to create those good habits and foster a healthier home environment by education. And just having dental presence in the medical pod has done that. So again, we're still brainstorming and trying to figure out how we can take care of everyone. It is impossible, but we're certainly trying to just save one smile at a time.
Yeah, that's fantastic. I remember talking about that idea many, many years ago, the idea of like, well, why don't we just automatically schedule them if they're here for a well child visit? Just tell them it's part of the visit, it's just part of it. And obviously, I'm saying that knowing that there are sensitivities around payment and things like that. We don't want to pull the wool over anybody's eyes in that regard. But so it's neat to see that kind of thing come to fruition and be actually happening. So I look forward to hearing more about the success of that. I feel like we've talked a fair amount about kiddos and prevention, but obviously there is a huge adult population that is in need of care, and they often come in with extensive needs that require major treatment plans, and it's difficult to get those treatment plans completed. So I'd love to hear you all talk a little bit about that. Dr. Brendemuhl, do you have anything to share on that topic?
Opinions, thoughts, yes. Solutions, I don't know that I have. Yeah, I mean that's the challenge, right? We certainly have some people with minor needs, but a lot of our patients are so disproportionately affected by, some of the social determinants of health, social drivers of health, or whether it's substance use, whether it's nutrition issues, lack of access to healthy foods, and those types of things. The diet is extremely carcinogenic throughout the life cycle. And so, when we do have patients that come in with, where things are just on fire, we really do our best to try to triage and prioritize things. I think that the sort of the more widespread use of things like SDF, silver diamine fluoride, to help trying to slow some of these brush fires, and hope maybe it's buying us a little bit of time to manage the urgent and emergent issues, and then get back to maybe we have a chance to restore some things, versus if we just need to be able to get teeth out. There's a big thing for us in terms of really wanting to prevent escalation to a higher level of care. And because we know that patients that end up in the emergency department or end up admitted to the hospital because of facial cellulitis or some really bad tooth-related infection, the cost to the patients and the cost to the healthcare system is astronomical. And if we can see them in one of our clinics, and maybe we're able to pull a tooth before it leads them down that road, and maybe we're not able to, but maybe we can start with some. And so we've really tried to prioritize and sort of schedule the urgent and emergent ones where we need to. For patients that are most at risk, we try to hold some slots available for patients who are awaiting chemotherapy but need dental clearance before they can take certain medication, radiation, oncology type of treatments, things like that. We try to keep priority slots available, and we do at our main clinic have a dentist that is completely dedicated to emergencies. We have a walk-in clinic every morning, Monday through Friday. We take the first 8 that show up on his schedule, and sometimes a few extra, quite honestly. And he'll pull teeth all morning long, or he'll manage the infection and refer to one of the other docs for treatment. So we've tried to be as aggressive as we can in preventing escalation of dental problems to dental emergencies and dental emergencies to hospitalizations. But it's tough. It's always a struggle. So, like I said, lots of opinions. I don't know that I have solutions.
Yeah, that's great. I love that you mentioned SDF and just other treatment modalities that can maybe help prevent future escalation. Shuntae, what about NOAA? Anything? I know you mentioned that you often get an opportunity to talk to family members and parents that when you schedule those well child visits. Are you all doing anything else to help address the need among the adult population?
Yes, similar to Valleywise, we have same-day emergency appointments from 8 a.m. until 3:30. They can walk in, they can call in, we're going to see them. All of our sites are open to anyone, whether they're insured or uninsured. We want to get them stable and also prevent them from going into their local emergency department for dental care. So that was our best approach with the resources we had, and we're hoping that more resources will be available to address the need, because it is a great need.
Yes, it definitely is. Ruth, I know at one point, this was probably many years ago. I feel like I've been around for too long now. As soon as I started saying like a decade, I was like, oh man, that might feel so old. But I remember at one point El Rio was really focusing on, and I think all health centers do this, but I remember talking to former leadership at El Rio specifically about targeting patients with diabetes and hypertension, and because we know that they have those coexisting conditions can be really problematic if you have poor oral health. Are you doing anything in that area or any other strategies to help those adults that have high needs?
Well, like most clinics, we're trying to do our best and as much as we can. As I mentioned, we opened several clinics. We now have a total of 7 all around town. We do have some dentists that are dedicated to do emergency visits. So we are definitely focusing on that. As far as caring for everyone and having enough appointments, that's also a challenge that we have. As you may know, most of the FQHC clinics have that problem where there's just so many patients, not enough appointments. As far as focusing with patients that are medically compromised, well, we have our SIA location clinic where also an embedded program is in there, and they do provide dental appointments for this population. We do have a program of 2 coordinators that work directly with this population to schedule appointments, call them to remind them about their appointments, and just facilitate not just dental appointments, but also their medical appointments and their follow-ups and things like that. As far as the Rio in general, as a whole, not just dental, we have a program of RNCCs, and those are nurses that work directly with chronic medical patients, and they help them schedule their appointments, and just ordering their medications. These are typically older patients, and so that's one of the things we are doing. And as far as dental goes, I mean, just doing the best we can, really. Again, having extended hours. We have some dentists that start as early as 7 in the morning, as late as 6 at night, and again, just like everybody else is doing, Dr. Brendemuhl and as well as Shuntae and Noah, doing the best we can.
Yeah, absolutely. I know COVID brought many challenges in terms of staffing that have, many of which have persisted. I have not heard that come up too much yet, but I'd love to hear how the staffing situation is for you all. Are you getting the providers you need and the support staff? What does that landscape look like? Shuntae, we'll start with you.
Definitely the clinical support is lacking. Since COVID, we did a market rate analysis to see if we needed to increase pay for the clinical support team, to see if that would bring them back to the dental field. But just even being out in the community and talking to former assistants, they just opted to go with other means of employment. I think COVID brought a lot of like a bad stigma to dentistry. Because we're working in the oral cavity, they are more likely to be exposed. And I beg to differ. I think that we take the necessary precautions in this profession more so than any other profession to keep ourselves safe. We know how to don and doff PPE probably better than most hospital clinicians. So I think that it is extremely safe, and there has not been one case of COVID that has been caught in the dental clinic. So I think that for us, staffing has definitely been a challenge since the pandemic for both our dentists and our dental hygienists. Prior to COVID, our dental hygienists, they had assistants, but once COVID hit, we had to pivot that focus and put those assistants with the dentist. So we are actually still struggling with that. It's getting seemingly better, but again, we're not back at our like 3-to-1 ratio where we would like to be, especially in the pediatric realm, and then a 2-to-1 for the general dentist.
Yeah, I was talking with Michael Pedersen earlier, Shuntae, and he told me that you started in March of 2020, right before the dental clinic had to shut down. So that's a great timing.
What a way to be welcomed to hear, well, we're going to shut your department down.
Goodness.
And you're going to start COVID testing.
Dr. Brendemuhl, how about you? What's the staffing situation for your dental program?
Yeah, it's been really interesting because we do have a lot of staff, both support staff and providers that have been here quite a while. We've got a pretty long tenured staff, so we're lucky in that. But the ones that have turned over, it has been difficult to get the right fits. We've had applicants who, would schedule interviews and then just stop communicating. We had one person who went all the way through the initial process, and on the day of their orientation onboarding, just didn't show up, and we never heard from him again. We got ghosted at Neo. Like, we called the check-in, like, "Are you okay? Do you need anything?" I think we got acknowledgement at some point that they were alive and just had just done something else. But it was like I was baffled by this, and but there are different. It's a very different world than when I started working. There are different priorities for people. I think a lot of industries were able to go to remote work, or at least part-time remote work, and we're able to pay a decent amount for people to stay at home, which is a great thing. And I think there's a lot of really good things that came out of those types of moves, but then it did hurt some of the in-person type of things, especially if we don't keep up with the pay rate and things like that. I think that'll always be a struggle in most of our clinics. I think we did the same thing. I think Shuntae mentioned, I think it was Shuntae had mentioned, like, the market adjustment evaluation sort of thing. Like, we went through all that, and we were able to give some raises and, a small cost of living adjustment. Like, we have a whole compensation team that did the numbers on that. And, a lot of our people can make more money if they go into the private sector. And they don't, we're part of a pension system. So there's like another chunk that comes out of your paycheck every time. So there's we really have to educate people of the benefits of working in our clinics and the benefits that come with it that don't always show up on every single paycheck. But we try to, as much as we can, hire for culture, because I think we can train some of the skills and we can train what we want, but we want the people who have the right attitude, who want to be part of a team, who want to care for people, in good days and bad days, who want to be here and be a part of something like that. But we still have a few DA positions that we're recruiting for. We're close to filling all of our spots, but so we've made some progress. But yeah, it's been tough.
Yeah, that's such an important point, finding the right fit. I remember the medical director at North Country Healthcare did a leadership video for us, and one of the things she talked about is you can tell pretty quickly if somebody is not a fit for the health center environment. You really have to want to be there to help people, and that has to be your main driver. So I think that's a really good point, and that's can be hard to find.
I think for me, I've noticed more. I paid a lot of attention to the language that people use. because I think when the applicants talk about those people and this and they start casting aspersions on things, like when they start repeating some of the stigmatized beliefs that that a lot of the community has, like that's something that's going to be hard to overcome if they come in with an attitude of of that. So it's that, to me, I've tried to really listen when people show us who they are, and try to find people who want to be a part of this and who want to do some good in the world. So
Yeah, absolutely. All right, we will move on to our last question, which is how can community and advocates help support FQHCs? And we'll start with you, Ruth.
Advocacy, right? And be active in your community. And also legislation. Be part of that. There are always bills sent, right? That hopefully will help have more access to care, and where we are hoping and we're very hopeful that Medicaid will at some point provide comprehensive care for dental and not just medical. This is something that I talk to our, especially, over 21 years of age and their homeless population, and reminding them, I'm glad that you do have access, so your medical is covered. Unfortunately, your dental is only covered 2 times a year for emergency. And it's a tough conversation to have, and especially after doing a dental screening and realizing that this patient can definitely utilize these services. So being active in your community and funding and just doing the best we can, really.
Yeah, I love that emphasis on community. Obviously, that is what community health centers are all about. I don't know if everybody knows this, but in order to be a HRSA-funded health center, you have to have a patient majority board. So at least 51% of your board of directors have to be patient users. And I think, to Ruth's point, that's so crucial, having people that are actually receiving your services, part of the community, also driving your health center from a strategic lens, I think is what another thing that makes health centers so special. So
yeah, funding, and I'm sorry if I may add funding, and yeah, just being part of, we community health centers, we are part of the community, and in order for us to be here, the community has to support in one way or another.
Thank you, Ruth. Dr. Brendemuhl, what about you?
For community members, for advocates, my biggest, I don't know if it's advice, but the way that I would ask is to communicate with your health centers and get to know who they are, understand the services that they provide and how they kind of do it. Because if there's a lot of, I think, at least in my experience, there's been a lot of misinformation about what's done. Oh, go to Valleywise, they're a free clinic. Well, no, we're not a free clinic, but we will not turn you away. So it's understanding the services that are available and the things that are there in your communities. And get to know them and ask, because I'm part of a big organization in a very urban location, with quite a few resources. As thin as we are in some ways, we have quite a few resources, but not all health centers are like that. In fact, I think every health center is incredibly unique. So get to know the people in your community and find out who they are and what they need, because somebody else may have a very different ask of you than what I would to my community members. But yeah, and I think that, and if you're at all involved in education, the more you can sort of helps kind of spread the gospel of community health centers in a way, the more you can speak to the quality of life in working for FQHC and the mission and values that are associated with it. I had professors in dental school who spoke very poorly of community health. And it took me a while to get here to the point where I understood that was what I was being taught, literally taught, was not the reality, and it shouldn't have clouded my desire to help people in a way that was meaningful. So anything you can do to kind of spread the word and teach people to be a little bit more understanding, a little bit more open to sort of the inclusive message that we try to preach. And yeah, I think it's got to start with our learners and go from there.
Yeah, I know we're at time, but I just want to share just to Dr. Brendemuhl's point, and I want to give Shuntae an opportunity to answer this last question. One of my personal goals is to start like a quarterly FQHC 101 webinar so that we can regularly be educating, general public, partners, even health center staff that don't really understand where they work and what they're part of on FQHCs, because Dr. Brendemuhl is right. There are so many misconceptions. I actually had someone tell me once that worked for a pretty prominent dental organization. This was over a decade ago, that health center dentists are just lazy because they don't want to run their own practice. And it was just like, oh my goodness. So yeah, a ton of misconceptions. All right, Shuntae, over to you for the last comment on that question about how can community and advocates help support FQHCs?
I'll wrap it up really quickly. I think it's really important for people to get to know those community health centers in their actual community, understand the services, again, that they offer, but also help remove that stigma. Once you learn about it, that there is great quality healthcare at our health centers. Sometimes, in my opinion, it's better than what you can get in the private world. And I may be a little biased to public health because we really offer whole person care from head to toe, and you don't get that going into your private dental practice or going into your private medical practice. So it's just really important for us to advocate and educate on that piece. I always like to tell my team, we are who we serve. We are the community. We are who we are serving. We love to hire folks from our community to ensure that we understand who we are serving. We are serving one another. So.
Yeah, I could not have said it better, Shuntae. And yes, I was actually going to say exactly what Taryn did, which is that health centers are so regulated and they have so many requirements that they have to meet. So I completely agree. The quality is top notch, the best that you're going to get. So I'm obviously so passionate about this topic. Thank you for the opportunity. Thank you to our panelists. You were fantastic. And I will pass it back over to the Arizona Oral Health Coalition team.